I am Vania Hungria, and I am an associate professor of hematology at Santa Casa Medical School, and I am a medical director at Clínica São Germano. And I'd like to tell you about the landscape in Latin America. In Latin America countries, approximately 88% of multiple myeloma patients receive treatment from the public health care system. Access to exams ranging from simple diagnostics to molecular testing is very limited. Few patients have access to cytogenetic tests. There is one study that showed that more than 50% of patients in the advanced phase ISS2 or ISS3 of the disease. And about the treatment, we have new drugs like immunomodulators or proteasome inhibitors improve the landscape for multiple myeloma patients. But the majority of the patients in Latin America don't have access for these drugs. For example, thalidomide was the first drug that showed efficacy. Due to the low cost, many countries in Latin America have access, but access to novel therapies is usually very limited due to delayed approval or incorporation, mainly in public institutions. Transplant availability is limited too, and there is a great disparity in outcomes and survival between public and private healthcare facilities. Because in the public institution, the novel drugs, the patients, they don't have access for novel drugs, but for private patients, they have access to novel drugs, novel treatments. And I can tell you that we have, for example, in Brazil, 25% of the patients receive treatment in the private setting, and 75% of the patients receive the treatment in the public institutions. So I can tell you that the majority of the multiple myeloma patients have received the treatment in public institutions. So the access is very limited. The one important thing is that the long time lapse between, for example, between the diagnosis and the referral for autologous transplantation has been highlighted as a common problem. And we have the problems with the diagnosis too, because we need early diagnosis and we need more education programs, because it's very important to increase awareness. Include that of specialists in other fields. I did that we can tell you that it's very important to bring and the analogy for another fields. We need more facilitated access to exams, from simple diagnosis to molecular testing, FISH, for example. We need to increase the number of beds for autologous bone marrow transplantation and better access. And the most important is additional novel agents in therapeutic arsenal and increase the access. And for this, we need more discussion on policy, and the price for these agents is imperative. In our region, we have to increase the participation in clinical trials too.